Hi, my name is Raquel Tatoy,
I'm Paul Tatoy.
And Vanessa Tatoy.
and we're going to be talking about the Coalition Against HIV in Latino San Diego. To begin our introduction, we're going to talk about the needs assessment, goals and objectives, interventions and strategies, program considerations, evaluation, and then our conclusion. To begin our assessment, we're going to talk about phase 1 of Precede and Proceed, which is the quality of life. Individuals with HIV have a diminished quality of life once transitioning from HIV into AIDS. They are unable to function with daily functions, typical getting dressed, feeding themselves. And next is going to be life expectancy. The average age from transition of HIV to full-blown AIDS to death is 45 years of age. Isolation. Many individuals with HIV feel isolated because of their HIV status. They're treated differently and makes them feel like they're not part of the community. Next is going to be negative behavior. A lot of them tend to feel helplessness, hopelessness, and resentment against the community because of their illness. Next, we're going to talk about the epidemiological assessment, environmental poverty. Latinos rank amongst the highest of low income in San Diego County. Access to care because of lack of employment and or jobs and not having the funding to gain medical insurance. They do not have access to care for treatment or even testing. Education, many are not educated or have not received an education, which they fall in disadvantage to other individuals. Next, we're going to talk about behavioral MSN, that is men having sex with men. As you can see, they account for 61% in 2009. The transmission of HIV by MSN, men having sex with men, is 61%. Many of these men have unprotected sex, and they have multiple partners. Our mission and vision. The mission of the Coalition Against HIV and the San Diego Latinos is to empower the Latino community against the stigmas of HIV, to educate them on the risks that HIV and AIDS possess to them and their community, and to provide this community with a safe, anonymous, and culturally aware place to receive testing to know their status. The goal statement is the goal of the Coalition Against HIV and Latinos is to decrease the incidence of HIV in the Latino San Diego community and to empower the people of that community by spreading awareness.
Now we have the assessment. So we did the precede proceed. We're on phase 3. We have the predisposing factors such as culture, religious beliefs, and education. Culture primarily through Catholicism. It's not generally accepted, so that's where that's coming from, culture and religious beliefs. Education, there's little education. They don't know how to use, or they're not sure how to use condoms, or they're unwilling. Economic status, low poverty levels. That also ties into education because the less money you have, lower education you're most likely going to achieve. And immigration. They're scared to get tested because they may be illegal and they may be deported. Reinforcing factors. So we're going to go in with religion, culture, cultural stigma, and fear. So religion, like I previously said before, Catholicism not generally accepting of gays. So they're scared to come out to their family members because they have a fear of being disowned. Ties into a cultural stigma as well. Enabling factors, access, availability, and barriers. So the access, how easily accessible are these clinics to where they can be tested? The availability of these clinics, when are they open, how are they going to get there as well? And the barriers, transportation is a big issue. Low income areas, typically they're not going to be able to get there if they don't have money to buy certain things, how are they going to get to a testing clinic? And our program goal. Our program goal is to incorporate existing efforts, so tie our program in along with others to help fight this epidemic, decrease the prevalence, empower the Latino gay community from within San Diego. So basically we're going to bring them all together and as a community fight HIV. The process objective. Our start date is going to be January 2015. The process administration is going to be access to budget, marketing, collateral, and personal support. Impact objective. Our impact objective is to, by December 2015, 50% of the population will be able to identify local testing sites. Our learning objective is by March 2015, increase population of prevention courses by 30%. The behavioral objective, by June 2015, 25% of participants will use condoms. The environmental objective, by 2016, testing site will be increased by 10%, and the outcome objective is to reduce the number of HIV infections by 2020. We also have our learning strategies. So sex education courses is going to teach people what to do when having sex, how to properly put on condoms, and other birth control methods. PSA distributions, websites, Facebook is going to be a big thing. You can go into the Facebook and find out how local support groups and things like that, and the website is also it'll all tie into the community to help fight the HIV epidemic. Strategy 1.
For behavior change, strategy 1 is dissemination of condoms, initially free distribution, and low-cost purchasing at various pharmacies. This is removing a barrier of perhaps maybe seen as an expensive means of preventing HIV, so making it available at a low cost or even free will push them to get the condom in the first place. Switch. Strategy 2, invite community members to focus groups and learn about HIV risk factors. This is to empower the community and to invite members of the community to come and make focus groups so we can get an idea of how these people feel about the disease, how they feel about people who have the disease, and we can learn more about the people that we're trying to help in the first place. It'll help us better implement our program because we're not only penetrating the focus group or we're not only getting into the community, but we're learning what the community wants and needs are instead of just assuming that we know best. Switch. Strategy 3, partner participation, bilingual courses, and support groups. The partner participation is encouraging gay partners to come together so they can kind of form a stronger alliance amongst the gay community. Including the partner empowers both of them to have a negotiating power of asking their other partner to use the condom in the first place. Bilingual courses, Latinos speak Spanish, so we need to be able to target our community in both languages so they understand what we're trying to implement. And support groups is for people who are either facing the isolation from their community or they're already infected with HIV and need a safe place to go to talk about their issues. Next. Environmental strategy. Engage pharmacies, recruit physicians, partner with hospitals and local community clinics, and condom vending machines in all gay clubs. So engaging pharmacies to provide low-cost HIV medications, to partner with low-cost or maybe even free distribution of condoms on certain days or events, or to sponsor them. Recruit physicians. Latino physicians who speak Spanish are the primary providers who will need to treat these people, and they'll need to be approached with physicians who know their culture, are culturally competent, and who can speak the language so they are understood across the board. Partnering with hospitals and communities and clinics, these are one of our major stakeholders, looking to Scripps, Sharp Healthcare, and Kaiser to really form a grassroots movement and help fund our cause in the first place. That's actually what we'll get our physicians from. And condom vending machines in all gay clubs, taking out the kind of shame that might come from purchasing the condoms. This is kind of just there, they can go get it, it's a little bit more discreet, and it's in a very popular place, so they'll have complete, full access at their own discretion. Next. Resources, considerations for our program, budgets, participation, program planners, health providers, transportation, access to medical facilities, and social marketing. Budgets is just how much money we're going to be able to have to fund our program. Participation of the community, which will be relying a lot on volunteers and people who know the community, because it is a sensitive subject. We want to know or make sure that we're using people who know the culture that we're going to be trying to help. Program planners and people who can properly work with the participants to form an alliance and distribute the program properly. Health providers who are culturally competent, can speak the language, and are aware of the sensitivity of the essence of HIV. Transportation is a big issue, providing free or just educating the public on cheaper or easier ways to get around to health clinics, or providing coupons or discounts just to make that barrier kind of fade away just a bit. Access to medical facilities. We would like to eventually implement safe and culturally aware clinics that are aimed for and locally in the Latino community. Something that maybe if transportation is an issue, it's there in their community, they could maybe even walk to it. And social marketing, PSAs, social medias, Instagram, Facebook. There will be a Coalition Against HIV for Latino San Diego Facebook page that they'll be able to visit. It'll have links to local clinics, and it will also have surveys that they can take that can tell them or help them measure how at risk they are. Impact evaluation, pre-program testing for baseline, just to get an idea of how prevalent HIV is in the Latino community, and also get a baseline of how much the community knows about HIV, the risks of it, and ways that they can prevent it. And we'll compare that pre-test to a post-test, which will be taken after the program is implemented, so we can compare it to the statistics that we gather from the pre-test. Make contact with physicians to determine the impact of HIV status. That can be done pre and post. We can talk to the physicians and see if after our program is implemented, if it made a difference amongst the ideas, the thoughts, and the feelings of HIV amongst their patients. And end of assessment, surveys and questionnaires will be given, especially amongst the student classes that we'll have, to see if they retained any of the information. And also, surveys will be given to the forums and focus groups that we have to see if we have successfully created a clinic that is culturally competent and safe for them to go, that empowers them to have sexual power over their sexual health. And next. Outcome evaluation. By end of program, there will be surveys, focus groups, and face-to-face interviews given to those who did and did not get tested for HIV at the newly implemented testing sites. Basically, I already covered this, but it's just to see if before we were there and after we were there, if our program successfully made this a safe place for them to go, and to see if it was effective for them to feel like this was a place they could go, that understood them, and see if we successfully removed any barriers. Evaluation to be shared with stakeholders, volunteers, and funders. These evaluations are going to be disseminated to the people who helped us, our stakeholders, like I said, Scripps, Sharp, Kaiser Permanente, in hopes that maybe adopt this program and use it within their corporations, and also be given to the community so they can see what an impact this program can do for their community and empower them to use it in the future. Next. Conclusion. We did our needs assessment, goals and objectives, interventions and strategies, program considerations, and evaluation. Questions? Oh, that concludes our presentation. Thank you.